Hello everybody. Hello. Now my name is Sumer Sethi, and I want you to my purpose of a brief. I'll have a very brief word with you today, and my purpose would be to show to you what exactly are USMLE questions and how to approach them, because I want to spend time with you to you learn various things in various part of your medical school, but when they ask you a question in USMLE exam, the question is actually a mixture of many subjects, and sometimes you do not know how to connect those dots, and sometimes you miss the question. So I'll be very quick and I'll show you a simple question from USMLE. This is how the questions are asked in your US medical licensing exam. Look at the question now. A father brings a 3-year-old son to the clinic for evaluation. In the past 24 hours, child has had multiple episodes of painless bloody stools. On physical examination, vital signs are within normal limits. There is mild abdominal discomfort. A technetium 99M per technate scan indicates increased activity in 2 locations within the abdomen. Look at the question now. Look at the length of the question. Cell originating in which organ account for increased radionucleotide activity? Stomach, pancreas, small intestine, gallbladder, liver. Okay. Now, thank you, Bangalore people. Thank you so much, sir. We appreciate your feedback now. Now, for the students now, did you notice this is a kind of a question where you need to know little bit about medicine, little bit about physiology, little bit radiology. Now, what exactly is a technetium 99 per technate scan? Technetium 99 per technate is a radioisotope. When you give it to the patient, it is taken up by the gastric mucosa. It is taken up by the gastric mucosa. Okay. Now, why then you will have uptake in 2 places? Why not only 1 place? It should only be in the stomach. Why 2 places? Now, so I want you to see how they club a visual with the question. Now I want you to look at this visual in front of you, and you will see my black arrow pointing towards uptake. If you see the if you see the upper part of the image, you will see uptake in the stomach. Then you see a black arrow pointing to something. At the bottom you see that is the urinary bladder where the isotope has been excreted. What could it be? Now I'll again reinforce my point. This is how they ask basic sciences. This is basic sciences question, but actually you need to know, connect the dot. No, Mysore, tell me what it is. Can you imagine now this patient has technetium per technate uptake. What is that? That is gastric mucosa uptake in 2 places. That means this patient has ectopic gastric mucosa. What would it be? Meckel's diverticulum. Perfect. Thank you very much for answering now. Do you now understand what is their meaning of basic sciences? Their meaning of basic sciences is they go more clinical into it. But the problem is you have to connect the dots somewhere. You have to know a little bit about physiology, little bit about medicine, little bit about anatomy, and put them all together. Now look at the question again. What was the choices in the question? Stomach, pancreas, small intestine, gallbladder, liver. Now all the other choices, they do not take up technetium per technate. Only if a Meckel's diverticulum has ectopic gastric mucosa, it will take up technetium per technate. So what is the answer here? Stomach. Simple to understand. Now, if the same question was asked in a PGME exam in India, they would give you a straightforward 1-line question. What is the investigation of choice for Meckel's diverticulum? What is the answer? Technetium per technate scan. Technetium per technate scan. Is that simple to see here? And if they have to give you a visual to make sure that you understand, they will show you a visual where you will see isotope uptake in the stomach and bladder. You are not supposed to see technetium per technate uptake in intestine. If you see, what is that? Ectopic gastric mucosa. What could it be? Meckel's diverticulum. Simple to understand. Now I show you one more example here. Very typical question, very typical USMLE thread. And it has, I have taken everything into it. This question would have medicine, pathology, surgery, everything in it. Okay. One person has 48-year-old male, medical history for hypertension. He's a hypertensive, note please. Recurrent urinary tract infections. Okay. Something to do with the urinary tract, mitral valvular prolapse, and diverticulosis in the bowel. Okay. Now if you would think again, something is building up. Now think about it. What could it be? A hypertensive male, urinary tract infections, mitral valvular disease, and diverticulosis. If I add them all, can you tell me a syndrome? Can you think of a syndrome already? No. Okay. Now let's go forward. No, Mangalore, read it very carefully. Let's go forward. This person now develops a sudden severe headache while watching television on his couch. This is typical American, language. They sit in the couch and they watch TV. Okay, this is not like us. It's not like India. He calls 911. That is again American number, and reports to paramedics that somebody has shot me in the back of my head. This is typical thunderclap headache, very severe headache. Now, along with headache, he has nuchal rigidity. Why would somebody has nuchal rigidity? Because there is meningeal irritation. Meningeal irritation. Why would meninges be irritated? One cause is meningitis, like Mangalore mentioned. But what is happening in this patient? What could it be? Subarachnoid hemorrhage. But why? What was the first history all about? That entire history that I had given you can be put together in autosomal dominant polycystic kidney disease, as Bhubaneswar people and Tanda people have rightly identified. Now can you understand how they make a question in USMLE? You have to connect the dots that you learn in MBBS. You know from your pathology knowledge that there would be a patient with polycystic kidney disease, brain association, aneurysms. What else can be there? Hepatic cysts, mitral valvular prolapse, and hypertension, you know this, and urinary tract infection. The patient can present like this. So this is a typical history which builds up with polycystic kidney disease, goes on to medicine, says there is a patient now with a severe headache. We know we are looking at subarachnoid hemorrhage, and then they will give you 5 choices and you have to pick up subarachnoid hemorrhage, and they can actually add a visual like this. Okay, this is how the CT brain of the patient looks like. What do you see here? What is the finding in the CT brain? Now, very tough. So, or what they may do is, instead of keeping a CT brain image, they put a pathology specimen image. What does what does this pathology image show you? This is polycystic kidney, and you can see multiple cysts in the kidney parenchyma. I'm sure you can appreciate. And if I have to give an abdominal CT, I can actually give you an abdominal CT like this. Now, can you see the organ, the larger organ, that is the liver, is filled up with dark spaces? What are they? Multiple cysts in the liver. And we know from our knowledge of pathology that yes, Tanda, very good. Polycystic kidney disease is associated with hepatic cysts. So they can actually mix and match the visuals with the question. And the question no longer remains one subject, it becomes a concept. You need to know the concept called as autosomal dominant polycystic kidney disease, and you need to know the concept called as subarachnoid hemorrhage. Okay, now I'll show you a trick. Okay, I'll show you a trick. Now, I would want you to look at the CT images in front of you. This image is showing you the posterior fossa, and you can see the cerebellum primarily in the sections. Now I want you to look at the further sections, and you are able to see the brain at a higher level. Okay, let me just bring the images for you. Okay, now I want you to look at the sulci. Look at the sulci in this image. What do you see? Sulci are dark. Why are the sulci dark in a normal person? Because they have CSF, so they appear dark. This is how a normal CT brain should look like. Now everybody, I want everybody to remember this image. Just remember. Okay, now once you remember, by the time you remember, I'll take you back to the first image that I showed you. I'll take you back there. Okay, give me 1 second. I'm taking you back there. Always remember, in a normal CT scan, sulci appear dark because CSF appears dark on a CT scan. Now compare this MCQ now. Look at this now. What do you see? Sulci in this patient are not dark. They are white. Why are they white? Because they have hemorrhage in the cerebral sulci. Why would somebody have hemorrhage in the sulci? That is subarachnoid hemorrhage. And now we come back to the same question again. Why would somebody develop subarachnoid hemorrhage? Because of aneurysmal rupture. What is the cerebral association of ADPCKD? Cerebral aneurysms. Now can you see what is the difference between USMLE and a routine exam? They want you to connect the dots. They do not want people who are mugged up. Okay, they want people who have understood the concept, and when the patient comes, they are able to apply. Are you able to follow me? Now, I always want you to understand, in your medical school, we have made categories. We have made categories in subjects, like this is anatomy, this is biochemistry, this is physiology. But I hope you can understand, when the patient comes to you, patient is only one. He is not a surgical patient of medicine. He is one person. So what is the MCQ? MCQ is an objective representation of a clinical situation. Okay, that is how USMLE exams are structured. And I want you to know today that this is my purpose today, that you have attended this seminar today. My purpose in DAMS is to be the helping hand for each one of you sitting in your remote cities. You can see in front of you, you have seen varied places we have discussed today. Now today DAMS represents not only MD, MS entrance classes. We have a wing for USMLE which is headed by Dr. Mala, and you met her today. And we have another wing which we will be discussing with you in due course. We have a wing for PLAB exams, membership exams, and we have a wing for dental students as well. My vision today is that I want to bring the mentorship that a student needs. If he is sitting in a remote location today, he should be able to get the same mentorship, same guidance that a student sitting in Delhi gets, a student sitting in Mumbai gets. I want to be able to help each one of you to achieve his dreams. The dream may be PG entrance seat, it may be MLE exam, it may be UK exam. Trust me, you would have us helping you in anything you choose to do after MBBS, or for that matter even for dental graduates. With this note, I conclude the today's seminar, and I hope you benefited from the activity that we have done today. Feel free to write back to us at usmle@damscity.com, and Dr. Mala would be happy to answer back each one of you personally. Thank you very much. I wish you all the best. Thank you very much.